Some of you know me. My name is Heather Martin, but if you don't, I have an amazing birthing and pregnancy class, and I am a mom of 4, and I absolutely love talking about pregnancy and birth and postpartum. Like, this is what I talk about. This is my jam, okay? So today I just want to talk about pregnancy anatomy. I think it's so important to understand this and to kind of know what's going on in there and what it looks like, okay? First I have to say, like, how beautiful is this poster? Like, pregnant women are so beautiful and it's such a blessing, and this poster just shines that pregnant woman's body. Like, it is so beautiful. And so I just have to, this is awesome. I got it on Amazon, so it's just beautiful. I just absolutely love it. I had to get it. So first we'll talk about we'll just talk about the anatomy of a pregnant woman briefly. I do go over it more in depth in my class, in my pregnancy class, and the link for that is in the bio if you want that. But first we have the lungs. This is your lungs. The liver is right here. These are your intestines. This is your stomach. We got the vagina down here, and then this is the rectum. So that's kind of the basic, you know, you got all those things. This is the mammary glands in your breasts, so that is where your milk is produced. Usually that starts producing while you're pregnant, and you may even notice some leakage during pregnancy, and that is completely normal. Don't be worried about that. So that's something important to understand, that you have those glands and that's what they do, okay? This is the uterus. So the uterus holds baby, and you have a uterus unless, you know, you had a hysterectomy or you were born without one, but the uterus is what holds your baby, and then inside the uterus is an amniotic sac that your baby is in with amniotic fluid. Okay, so that's where your baby lives. And then you've got the placenta and the umbilical cord. So that helps, the umbilical cord goes to baby's navel or belly button. And that kind of helps transport nutrients, blood, get rid of waste, different things like that. So you are connected to your baby when you are pregnant, and it is so beautiful. Our bodies are so amazing that they can do that, right? So then we have your pubic symphysis, which is your pubic bone. Your bladder is here. This is your cervix. So as your cervix is dilating, that is opening up to 10 centimeters. Again, you dilate up to 10, and then that's when you're ready to deliver your baby, to push your baby out, your beautiful blessing. And then this yellow area right here is the mucus plug. So what is a mucus plug? It's kind of what it sounds like. It just plugs up, you know, your uterus, and so that no bacteria or anything that shouldn't be in there with your baby doesn't get in there, okay? And so sometimes when you're in labor, that will actually be discharged, and you will notice that or see that. Some people don't, and that's fine too. So that is the beautiful pregnant anatomy. Just briefly, I do want to say that looking at this, you can tell that, so when baby is small, you know, as baby grows, gets bigger, things get more squished. So that's when you notice you're breathing more heavy, or your lungs, you know, are more squished in there. Your stomach is squished. So typically then, as baby gets bigger, you're eating smaller meals, but you're eating more frequently. That's because baby is squishing your stomach, okay? And then later in pregnancy, usually baby drops. So what that means is baby is down further. Baby's getting ready to, you know, be delivered, to come into this beautiful world. And what you'll see when baby drops is you can breathe easier. You may be able to eat a little bit more in one sitting. Maybe some people still can't, but you'll notice that you can breathe a little bit easier. But you'll also notice that you might be going to the bathroom more frequently. That's because baby's pushing on your bladder. Okay, so that's just kind of, it's fun to visually see this and to kind of understand it a little bit better. So the link to my class is in the description below, and I hope this really helped you, and you have an amazing day.